I seem to forget occasionally to take my medicine on time.
I take medications all day, at least 8 times a day, and it's very hard to remember to take it because you get busy.
Because my husband occasionally forgets to take his medication.
Dad, after breakfast, take 5 white and 1 pink pill with a glass of water. Dad, after breakfast, take 5 white and 1 pink pill with a glass of water.
Reminder off.
The reminder is off for today.
Such a simple device, yet its application can change the lives of millions and have a great benefit to society. Greetings, my name is Gary Rotman, inventor of Rosie, the Reminder Assistant.
Can I help you?
Rosie, please not now, I'm doing a video. Rosie is a voice-controlled personal reminder assistant that allows you to record spoken alarms to remind you or another person about any important task that may often be forgotten. Utilizing cutting-edge technology, Rosie is ready to use right out of the box to set the time, alarms, and voice recorder reminders without touching any buttons. Rosie is so easy to use for the elderly once the reminders are recorded, and to record reminders by the caregiver is equally easy. Rosie prompts you along. You only need to remember a few obvious commands and questions like set the time, record reminder, and speak to her in a normal conversational voice. We included a handy card with the commands, or just look at the instructional sticker on the back of the unit, or just ask Rosie for help. And if there's a power outage, no worries. The battery backup keeps the reminders and the reminder times in memory. And the beauty of Rosie is that you can record reminders in any language.
Mom, let's set the first reminder for Dad. When would that be?
After breakfast.
And what type of pills is he taking at that time?
5 white and 1 pink.
Reminder Assistant.
Can I help you?
Record reminder.
Please record a reminder.
Dad, after breakfast, take 5 white and 1 pink pill with a glass of water.
Dad, after breakfast, take 5 white and 1 pink pill with a glass of water.
Say, keep reminder, or record again.
Keep reminder.
Please tell me the time the reminder should play, including AM or PM.
8:30 a.m.
8:30 a.m. Is this correct?
Yes?
Is this reminder for today only?
No?
Tell me the day of the week, or say every day.
Every day.
The reminder will play every day at 8:30 a.m. Is this correct?
Yes?
Goodbye.
Your voice reminders can be heard over 100 feet away. And if they can't remember even to say reminder off, then they simply push down on Rosie and she will stop speaking. Now, we focused on simplicity of operation, critical to help the elderly, not to frustrate them further. Now, I knew that if this was a problem for my father, it is likely a problem for others too.
My name is Marilyn. I have Parkinson's and I have to take medication on a consistent time every day, 8 times a day. And sometimes it is hard to remember to take it because you get busy. And it's very important with Parkinson's that you take your medication on time. And the Reminder Assistant does that for me and makes it a breeze.
Being in the timepiece business for nearly 25 years and specializing in high-tech applications, and with no practical solutions available in the market, we developed and tested our device that has already proven itself in test trials to effectively and with great ease help people remember important tasks. What I didn't realize is just how widespread poor medication adherence really is in the United States, Canada, and all around the world, with consequences for everyone. The U.S. Surgeon General, Dr. Regina Benjamin, has identified America's medication non-adherence problem as a massive public health concern. Many studies and reports were published within the last 2 years identifying some startling facts about poor medication adherence. 75% of Americans report they do not always take their medication as directed. This results in nearly 125,000 deaths. That's more than breast and lung cancer combined, and 25% of hospital visits for those over 65. These occurrences contribute to between $200 to $300 billion of additional healthcare costs based on additional doctor visits, more medications, misdiagnosis, unnecessary treatments, emergency room visits, hospital admissions, admissions to a nursing home, and worsening of the disease or even fatality. Not only are lives at risk, but it is an unnecessary expense that can be significantly reduced. And if you think this doesn't affect you, well, consider the added medical attention required for someone not taking their medication. If they are hospitalized, who pays for it? If the cost is picked up from government health programs, then there goes your tax dollars. If it is private insurance, then expect the cost to trickle down in higher premiums for all. Or if the hospital has to absorb an uncollectible bill, then they just bump up their cost of services so they can cover this expense. Any way you slice it, it costs you, it costs society as a whole. While this began as a problem of medication adherence, especially for patients with complicated medication regimens such as Alzheimer's or Parkinson's patients, using Rosie is hands-free, and she can provide a great benefit to the blind and visually impaired, as well as those with limitation of their hands due to paralysis, arthritis, and the like. From our trial run of a few hundred units, we have the feedback and testimonials from a wide spectrum of users, including the elderly, those with special needs, and others from the general public that just like the fun, innovative, and useful appeal of our device. We couldn't be more pleased with all the positive feedback and take it as a badge of honor that we are making differences in people's lives. Once demonstrated, the reaction from caregivers, either the spouses or children of patients, or professionals who work for home care agencies and take care of patients in their homes has been overwhelming. Nurses, pharmacists, health insurance companies, drugstore retailers, and retirement residences have all shown serious interest and enthusiasm in Rosie.
I love working with seniors, and I really enjoy helping them get what they really need. In most instances, either the children of the potential client or another family member or the client themselves might call and say, I'm just not able to do my daily tasks for myself anymore. I'm not able to bathe myself without falling, without worrying about falling, or dressing myself, or most often, I just can't remember to take my medications on time. Unfortunately, in very, very many instances, they cannot afford the extra time needed for people to come in and help them remember their appointments or the medication times. And to know that a reminder device at a nominal cost for them, rather than spending $30 an hour for a caregiver to come in and do that for them, is wonderful. It's very exciting, and the people that have been exposed to it are thrilled to know that that option is out there for them.
Rosie's simplicity to both the end user and to set up reminders is far better than any device we have found anywhere in the world. And in the high-tech industry, the simpler the device is to use, the more challenging and costly it is to develop. If only 1 of every 10 chronic sufferers or the blind would use Rosie, that would make a huge difference in their quality of life, give peace of mind to their loved ones and caregivers, and potentially save our health system hundreds of millions of dollars. Thank you for your time.